1 in 4 people worldwide will experience a mental health condition in any given year. 1 person dies by suicide every 40 seconds. Mental health problems can have a significant impact on individuals, families, and communities. They can lead to reduced productivity, increased absenteeism, increased healthcare costs, increased crime rates, as well as increased suicide rates. Nigeria has one of the highest rates of mental illness in Africa, with an estimated 20 million Nigerians suffering from some form of mental disorder. However, only a fraction of these people receive the treatments they need. The Nigerian government and other organizations have made efforts to address this problem. Although this is still in its early infancy, one such organization that has been at the forefront of speaking up and preferring solutions to mental health is Ditty Foundation.
My name is Ade Dotun, but everybody call me Ditty. I'm the founder and the chief advocate of Mental Health to Ditty Foundation, an NGO that tends to mental health awareness, advocacy, and support here in Nigeria. While I was in school, they start putting names to things that have happened to you in the past, and it starts making sense of why you act the way you do. So I got very interested and I wanted to know more. So after I got my master's and I came back, I had some of my own mental health distress. So at some point I tried to just end it all. When life comes so bad that you want to end it all. Then I started going to therapy and I started seeing a lot of changes in my life, and I felt people are suffering every day and they don't even know where to get help, and why not support them? Already people come to you and just talk to you, dump their stuff on you before. So why don't you just understand the concept around it and how to help better? So that's where it started. Officially, we registered in 2022, March. But before then, I'd started talking, mostly doing an awareness campaign online, talking to people. I think they started around 2019. So, but when we made it why we made it official was that, so sometime in 2021, I got a call from someone I've never met. Till now, I've never met her. And she said she was about to inject herself, to just kill herself. And somehow, she came across my video on Instagram. And it was like I was talking to her. So it felt like, oh my God, this little thing that I just go out there and just talk about has been able to save someone's life. So why not do it better? So just, okay, let's make it official. So the objective for us is that everybody needs to be aware of their mental health. Everybody needs to be aware that these things exist every day and impacts on every other aspect of our life. Why don't you give people that information? So the awareness is our core. But in the public health space, you don't want to generate demand and no supply. So that means you create that, these things exist, mental health problems exist. So what? So that's where the advocacy comes and the support. So advocacy in terms of what are the policies? Even in Nigeria, do we have such policies that supports people's mental health? Do people even know that these things exist? So we joined some networks of people who try to push, mental health thing and all of that. We're able to support a whole lot of other people to get a mental health bill. So that I'll be like, okay, if you can do that, so what still? So it's okay. If people now find out that there's something called mental health, they know that policies are there. How do they get the service if they have identified? So that's where the support part comes, where we either provide psychotherapy, and if it's beyond the scope of what we can provide, we can refer to the appropriate professional. So that's why we have a full continuum of education, advocacy, and support. So our motto is impacting one life per time. So we push for one person, at least one person is gaining that education, one person is being supported, one person is seeing that there's something better to their life than just ending it. So that's what we do. And in the last 1 year of when we made it official, we have trained over 1,000 people mental health first aid. So different campaigns, go to schools, go to events and say, mental health exists, go to organizations and tell them, okay, these are the ways you can identify. These are the things that you should watch out for. And if you see such things, these are ways you can help, at least at the first aid level. And these are resources that are also available, professionals that are available that can help you better. So we've done that. Then, during the course of my career and all of that, I tried to like get a certification to be a cognitive behavioral therapist. So that's also a kind of way to support someone. So I also provide therapy to people at the barest minimum. Very few people have to pay, because if you go out and say you want to get therapy, 20,000 naira, 30,000 naira, many people cannot afford. And since we want to impact a life pattern, if someone comes and says, "Oh, I just want to talk," the first thing we do is make it free. Then when that person talks, and if it's something we want to push forward or we want to support the person, we say, "Okay, you pay 10,000 for every session." But if it's something that we cannot, we refer. And there are some people that cannot even afford at all, like maybe people in the vulnerable community, persons with disability. And also we have gone to the communities of the blind, visually impaired, hearing impaired people to teach them that mental health exists, because we also know that these people are like having double burden. They have physical, they have disability, and they are having mental health problems. So all of these things we try to do.
Ditty Foundation is also working to reduce the stigma associated with mental illness in Nigeria.
Mental health is not a condition. Mental health is not a problem. Mental health is, everyone has a mental health, the same way we have physical health. But because it has been ignored due to lack of knowledge. So that's why now the awareness is more, because people are now understanding what it is. So it feels like people are killing themselves more. But because people are now looking, people have been killing themselves in time immemorial. I remember when we were growing up, you see somebody say they ate rat poison and all that, but nobody's talking about it. Then here in Nigeria, why it was a spiritual thing is because what we don't have a name for is spiritual. What we don't understand is spiritual. So that's okay. But for the grassroots, whatever message you're taking, you have to contextualize it. Because mental health status is determined by so many factors. And mental health conditions is an intersectionality of different problems, ranging from social welfare to economic status, to education, to inclusion, to equity. It's a web of so many things. So if you want to go to the village and tell somebody that could barely eat or could barely afford proper education, that it is a mental health problem, you have just complicated the person's problem. But you can break it down and say, okay, yes, you don't have food, you don't have clothes, you're not properly educated. It could impact on the way you think. It could impact on the way you feel. It could impact on the way you even see yourself. So irrespective of all of these things, you should still see yourself as worthy. You should still see yourself as a good human being. You should still see yourself as a part of this whole complex. So who you're messaging to will determine how you send a message.
The Foundation's work is making a real difference in the lives of people with mental problems in Nigeria. Ditty Foundation is a valuable asset to Nigeria, and its work is essential to addressing the mental health crisis across the country.